Hi, my name is Madison. I'm a Methodist University PA student, and I see you're here today to learn a little bit about primary open-angle glaucoma, which is a mouthful. So for the purposes of this video, I will just be referring to open-angle glaucoma as glaucoma. But no, it is very different from its counterpart of acute angle closure glaucoma. So glaucoma is a chronic disease of the eye where the angle is open within the eye. That's how it got its name, open-angle glaucoma. But the problem lies within the drainage system of the eye, also known as the trabecular meshwork. And when there's a problem with this drainage system, the aqueous humor within the eye, which is a thin, watery, fluid-like substance in the eye that is secreted continuously to maintain appropriate intraocular pressure within the eye, as well as provide nutrients to the eye structures. This substance is continuously filtered and drained through this drainage system. Whenever there is a problem with the drainage system, this causes an elevation in the intraocular pressure within the eye, which can eventually place too much pressure on the optic nerve, causing optic nerve damage, and can eventually lead to progressive vision loss over time. So the problem with glaucoma is that it is often silent to begin with, and many individuals do not know that they have it and that damage is occurring. So one of the biggest interventions that can be done for glaucoma are routine eye exams. It is recommended that anyone at the age of 40 or older have a comprehensive eye exam done for glaucoma to get a good baseline for checking for signs and symptoms of the disease. And some risk factors for glaucoma include increasing age, so especially anyone over the age of 60 is at an increased risk of developing glaucoma, family history of glaucoma, individuals of African American or Hispanic ethnicity, nearsighted individuals, people with ocular hypertension, which just means you have elevated eye pressures at baseline, as well as individuals with hypertension or diabetes. These individuals should be checked even earlier than the age of 40 and should be monitored frequently and have routine screenings done to monitor for the disease. Some diagnostic tests that can be done to diagnose as well as screen for glaucoma and monitor treatment over time include tonometry, which is just checking intraocular pressure within the eye. There's another test known as optical coherence tomography. This test takes a picture of the optic nerve in the back of the eye and does a scan and checks the retinal fiber layers as well as the optic nerve thickness because increased intraocular pressure over time can cause the optic nerve to thin. So if there's thinning of this optic nerve, it leads medical providers to think, hey, is there glaucoma going on and do we need to treat it? Another test is a visual field. This test maps a patient's visual peripheral vision, and because glaucoma targets peripheral vision often first. And some pharmacological methods to treat glaucoma include eye drops. The first line medication class for treating glaucoma are prostaglandin analogs, one being latanoprost. This class of medications work by increasing the outflow of that aqueous humor through the drainage system of the eye in order to lower intraocular pressure. Some indications for this medication would be elevated eye pressures. Some contraindications would be eye inflammation, so like iritis, uveitis, macular edema, as it can worsen macular swelling, as well as HSV keratitis. So individuals with a history of HSV keratitis, this medication should be used cautiously as it can cause a reoccurrence of the virus within the eye. This medication is often used first line as it is once a day dosing, as well as its great use in lowering intraocular pressure. And so it is recommended that one drop be instilled into each eye that is affected by glaucoma at bedtime once a day. And some side effects of the medication are eye redness or irritation. It can cause eyelash growth, and it can also cause some discoloration in the iris or the eyelids. Another class of medications for treating glaucoma are beta blockers, one main one being timolol. This is also an eye drop, and this medication works by decreasing the production of aqueous humor within the eye. And some indications would be if You cannot use prostaglandin analog drops, as well as increased intraocular pressure still not coming down enough with a prostaglandin analog or another drop class. Beta blockers can be used by themselves or along with another drug class. And some contraindications to this class of medications would be anyone with a lung disorder, so like asthma, COPD, as it can cause bronchoconstriction as it is a beta blocker. It can also cause a decrease in heart rate, so anyone with a heart block or bradycardia, slow heart rate, this medication should not be used, or it should be used cautiously. And the medication can also cause some fatigue. It is twice a day dosing, so 1 drop in either eye that is affected in the morning and at night. And another type of therapy that can be used to treat glaucoma is a procedure. It is a laser treatment. It is known as a selective laser trabeculoplasty. This laser procedure is an in-office procedure. It is relatively safe and it's very fast. It only takes about a couple minutes. A laser is shined into the eye and targets the trabecular meshwork, and this way it is a great agent to lower intraocular pressure. And this therapy is a great option for someone whose intraocular pressure is not coming down with drops, or someone who does not want to use drops or is just not adhering to their drops. So the main thing with glaucoma is that while it cannot be cured, it can be treated. There are great options and testing to be able to screen for it and catch it early and treat it. And so at this time, I would make sure the patient had no further questions. And yeah.